go from there. You guys will do great. Thank you again for doing this. Hi, everyone. I hope you all are doing well and staying healthy during this. So welcome to Ask the Experts. It's our first live stream where we are asking our faculty experts in real time questions regarding current issues. So today, clearly, we're going to be talking about the coronavirus, this pandemic that is all over the globe and that so many people have questions on. We're both going to talk about the virus itself and the impacts, and you will hear all this from three wonderful experts. So if you're also interested in hearing from more Ohio experts, you can visit ohio.edu/experts/ask-experts. So I'm Samantha Pelham, and I'll be your host for today, asking all of our experts the questions that we've prepared, as well as ones that you may have as well. So to introduce you to our wonderful experts, we have Dr. Winfried Just, a mathematics professor, Dr. Jennifer Hines, a chemistry and biochemistry professor, and Dr. Glenn Dutcher, an economics professor. Now, would each of you please talk a bit about your area of expertise and how this relates to the current pandemic? If you want to go ahead.
Yeah, I'll get started. As you said, I'm in the Department of Chemistry and Biochemistry, and my doctorate is actually in medicinal chemistry, which is all about drug discovery, and that's what my research area is, and particularly related to RNA, and that is very related to this particular virus, which is an RNA virus.
Yeah, Vinny, go ahead. I'll go last. Well, I can go now. So yeah, I'll go now. Yeah, sure. So yeah, thanks. So a lot of my work is dealing with the productivity of workers in firms, and specifically my focus is on the non-monetary factors affecting productivity of workers. And I have some lines of research that deal with trying to understand productivity effects of working from home. And given we have roughly half of the population right now is working from home, it seems to be somewhat relevant in the current environment.
Thank you. And then Vinny, if you want to go ahead.
Yeah, should I say something now? I'm getting awful lot of echo here, and I'm not hearing anything. There seems to be a big. Everything seems to be on a big echo, and I have no idea what I'm supposed to say.
Can you hear me, Vinny?
Yeah, I can hear you.
Great. Go ahead and just explain to yourself. I think the echoing's died down a little bit.
Okay.
Can you explain your expertise?
Yeah, probably. Yeah. Not hearing anything. So, there seems to be everything seems to be on a big echo.
Can you hear us okay, Vinny?
Yeah, so there's one big jumble on the line. I don't know what the problem. Yeah, I hear you, but
can you mute your computer just for a second?
No, but the echo is still there. The echo is still there. I don't. Oh, sorry. Now I unmuted my phone, but I'm still talking with all this echo, and I'm not sure. Yeah, I hear you, but so am I supposed to introduce myself or what?
Try muting your computer for a second. We'll see if that can.
Yeah, if you probably should mute all the listeners. Okay. Oh, now it's quiet. Okay, so thank you for giving us the opportunity to talk about this topic. I'm Winfried Just. I'm a professor at the math department, and I study mathematical models of epidemic spreading.
All right, let's see. Is there a way to close other windows that might have this also popped up in it that might help the echoing? Or maybe it's stopped. All right, everyone sound good? No more echoing?
Sounds good.
All right, great. Well, thank you all. So we can go ahead and start with our questions. All right, we will start with you, Dr. Hines. So kind of getting on the topic of the coronavirus and what it actually is, can you tell us, how does this virus work, and then what does it actually do?
So the coronavirus, like all viruses, is a really efficient package of information, of genetic information, and it gets into a human cell by actually binding to a protein molecule that the human cell naturally has on the outside of it. And the virus has a spike molecule, very club spike-like molecule that binds to the outside of the human cell and helps bring it into the human cell. And at that point, the genetic information that's contained in that virus package is released, and it's in the form of an RNA molecule, so like DNA structurally, but it's an RNA molecule that's then recognized by the human cell, and the human cell machinery makes all the virus molecules. So it's actually the virus genetic information kind of takes over the human cell machinery to make the virus molecules. And then it once the viral proteins are made, they then replicate and make more viral genomic information and make the viral package, and it gets out of the cell after that and usually kills the cell in the process by doing this a lot. And so, it's really, really hard to try to target it specifically because it's taking advantage of so many things that the human cell is doing naturally.
Great, thank you for that. We'll go ahead and kind of talk about some of the impacts too that are happening with the coronavirus, especially with the economy and
So, Samantha and Jennifer, could you please mute your mics? It shows that there's 4 people right now with open mics. One of them is me, and we don't hear anything.
Is that better? I'll go ahead and ask Glenn a question now, and that way we can all mute our mics, and hopefully that'll stop the echoing. All right, so for you, now that we are seeing meat packaging plants closing and 25% of production taken offline, are meat shortages going to be like the next great toilet paper shortage of 2020?
Yeah, thanks, Samantha. Thanks for the question. Yeah, I think that now all of a sudden we're really scared. As soon as we see some of these kinds of shocks hit the system, all of a sudden we become really scared, and we think, oh no, I won't be able to get food anymore, which is maybe a little bit more severe than toilet paper. Right. So if we think in general about these kinds of products and the characteristics of these products, we can think, well, toilet paper, there's a couple of reasons why we might have seen a shortage of toilet paper. First of all, it's storable. I mean, you can buy a bunch of that stuff. You can fill up your garage if you needed to and use it. You're going to use it at some point. So you might as well just go ahead and buy it now. And so if you think there's going to be a problem that you won't be able to get out, or you think other people are going to cause shortages, you have the storage issue with toilet paper. Meat is a little bit different than that. You can't really store it as easily. It's not as easy to, if you have a freezer full of meat, that's it. You can't really store anymore. But the other thing that I think that is really important that we're sort of missing is sort of the behavioral aspect of how we think about prices and how those prices work and what we think that companies are going to do in a response to these kinds of shortages. And what we normally see with the way that firms are responding to to these kinds of pandemics is that they usually don't want to increase the prices of necessary items. It just makes them look like a jerk. And then thereafter, as soon as the whole thing is over, a consumer is going to remember that, and they're going to say, I remember this is the place that raised the price on toilet paper, and I really needed toilet paper. And that's normally how we think that shortages are fixed, is just by raising the price. The price is eventually going to increase high enough such that, well, eventually people can't afford it, or they just find viable substitutes. That doesn't seem to be the case with meat. It looks like with meat, there's a lot of substitutes available. If you don't want to eat meat, you can substitute towards something else. And it looks also like the firms, the grocery stores, and so forth are not as hesitant to raise prices on meat. They feel like they can raise prices on meat, and then as soon as we see those prices starting increasing, then consumers are going to switch away from buying meat, and they'll start buying beans or these other kinds of goods. And so let's see what plays out in the short run. We might see a little bit of a shortage, but in all likelihood, we probably aren't going to see stores completely running out of meat like we saw with toilet paper. Hopefully not, at least.
Great, thank you. Well, that's good to know. Very
Yeah.
useful, especially for those meat eaters out there. All right, well, thank you for that. And then, Vinny, if you want to go ahead and we'll check your email and see if there's a way we can kind of get the technical difficulties sorted out. I'll come back to you for a question in just a second. And I was going to say, I would like to quickly remind those who are watching that we do have this, streaming on Ohio's social media channels and whatnot. And if you have any questions that you want answered, please feel free to send those in, and we will have those experts answer them during this live stream. Or, if we don't get to them then, we will still have them answered and sent back to you and put in the comments. So keep that in mind while you're listening, and please send in those questions. They would love to answer them. So while we are trying to fix the technical difficulties for Vinny, we'll go ahead, Dr. Hines, and then, you can talk a little bit more about the virus too as well. So our next question for you is, what is this remdesivir and how does it work? It's been in the media often, but people are still questioning what is it and how does this relate to the coronavirus? Go ahead and unmute yourself for a second, Dr. Hines. Oh, I think you're still muted.
So I see right now there is 3 people have open microphones. Glenn has his open, Samantha has hers open, and probably a lot of our viewers have their microphones open. And this is maybe where the sound may be coming from. Okay, so right now, okay, thank you. So right now we have only Samantha and me open. Samantha, could you please close your mic?
I think you're still muted.
So I see.
Hi, Vinny. I think that there might be other windows open where you're getting our input.
Don't have other windows open with the microphone. And this is maybe where the sound may be coming from. Okay. So right now. Okay, thank you. So right now. Samantha, could close your mic. Okay, so it seems we have resolved the technical difficulties. And if you could remind me of your question, that would be wonderful.
Of course, yes. So we're currently being bombarded with this daily information about COVID-19 numbers. How do you, as a mathematician, look at these numbers?
Thank you for this question. That's an excellent question because, indeed we are bombarded with the numbers. And as a mathematician, the first thing I'm asking myself is always, what does the number mean? And if you could remind me of your question. So,
of course, yeah. So we're currently being bombarded with daily information about COVID-19 numbers. How do you as a mathematician look at these numbers?
Thank you for this question. Indeed, we are. And as a mathematician, the first thing I'm asking myself is always what does the number mean? And if you could remind me of your question. So I don't know what you know, I believe that maybe microphones open from the audience that give us all this echo, because you know, I see only those of us have only one microphone open. So I don't know what's going on. You know, because I never had these problems before with my own classes. So you know, I'm always asking myself, what are these numbers really meaning? And you know, for example, we get these numbers that in the U.S. we have 1 million, over 1 million infected. So you know, yesterday's number was from one reliable source, 1,095,000 people, 30,000 new cases in the U.S. And then the next worst country, Spain, had 239,000. And a country that I'm very familiar with is Germany, 163,000. So when you see these numbers, you believe that if you see them out of context, you believe it must be about 7 times as worse in the US than in Germany. And that, let me start with some good news. That may not be the case, because when you realize that the US is a much bigger country, it has about 4 times as many people as Germany, then you can compare meaningfully these numbers only if you divide the number of cases in the US by 4 and then compare with Germany, or multiply the German cases by 4 and compare with the US. So a meaningful number, more meaningful, would be the total number of cases per million of population. So now if you compare the US, that has 3,308 cases per million of people, with Germany, which has 1,946 per million of people, you still get a much higher prevalence in the US than in Germany, but it's only about 50% higher. So that's, from the US point of view, maybe good news. On the other hand, if you compare, for example, the number of new cases in the US, which was yesterday 30,829, with new cases in Germany, it's about 1,500, then you get a total of new cases of 15,000. Then you get about 20,000 as many new cases in Germany, in the US, than in Germany. So that means we have a 5 times as high rate of new cases. So you need to first factor in how big is the country. That's pretty obvious. Now let's look at another number that is also much in the news: the number of tests performed. So we're hearing in the news that the US has conducted more tests than any other country, and that's actually true. So the US has conducted over 6 million tests, and Germany, for example, has conducted about 2.5 million tests. However, as we said before, the US is 4 times as big. Okay, if you take the number of tests per million of population, you get 19 tests in the US versus 30 in Germany. So the number in Germany is actually, if you account for the population size, about 50% higher. So, you know, the fact that the US has conducted more tests than Germany is true, but it's misleading.
Right.
So these numbers may be misleading if you take them out of context.
Interesting. Well, thank you for that. Yeah, that does make sense when you put it into the mathematical terms like that. All right, we'll go ahead and go on with our next question as well that we're receiving in. And then if you want to go ahead, Vinny, and look at your email to see if there's any technical difficulties that are arising that might be on your end of the computer or not, so we can get the echoing figured out.
Yeah, and Samantha, just to let you know, I'm back on. My computer had completely frozen, so I'm back. Sorry, I wasn't able to answer your other question.
Not a problem at all. We have another coming in anyway for you as that is, and you know, technical difficulties are all a part of what we're doing currently and talking about the impacts of it, and this is just one of them. But like I had asked before, I'll go ahead and re-ask it for you. We've been seeing in the media this remdesivir and whatnot, and so can you explain what exactly that is for those of us who don't know, and then how it works?
Yeah, so it's a small molecule that it was already in preclinical studies for the treatment of other viruses, and it was discovered or found out that it had activity against the coronavirus. And so it's a small molecule developed by Gilead Sciences in California, and it's currently undergoing clinical trials with patients, so COVID-19 patients, and the preliminary results indicate that it shortens recovery time by about 4 days. The clinical trials are still ongoing to really sort of figure out, what effect this might have on survival, improving survival rates and such like that. But that is hopefulness, right? But it's certainly, it's not a 100% cure, and there still is a lot of searching that's going on for that. But this particular small molecule works by inhibiting one of these viral machinery molecules, the protein that helps replicate the RNA, the genetic information of the virus. That's what it's inhibiting, and it's specific for the virus machinery and not the human machinery. So you have a better chance of having a good therapeutic index, of killing stopping the viral replication without harming the human cell.
Great, thank you so much. And then I'll go ahead and ask you, Dr. Ditcher, one more question, and then we are getting questions in from our audience. So thank you for that, for those sending them in. So your question that relates to the unemployment, how does this current unemployment picture look relative to prior economic downturns, such as the 2008 one? Oh, I think you might still be muted. Yep.
There we go. The good thing about this is it told me I was muted, so that's nice. So technology wins. Yeah, thanks for this. I think that the last sort of big bad economic impact we saw was in the 2008 recession. And in the 2008 recession, roughly 37 million people had filed for unemployment. There were 37 million new claims. In the current one, we have about 30 million. I think the obvious difference between those two is that in this current time period, this 30 million is within a span of 6 weeks, and that is huge relative to what we saw in the 2008 recession. And so sort of how we can think about that, right? If that sort of unemployment rates are coming in at a much slower pace, then in the meantime, those people who are unemployed have a chance to sort of find employment. Maybe you're unemployed a little bit for 1 or 2 or 3 months, and then you can find something. And so what it does is it means that the highest level of the unemployment rate during that 2008 recession was somewhere around 10%. That is, the worst case for us in that 2008 recession was 10% of the population who wanted to find a job weren't able to. In this current pandemic, because we've had these really sudden shutdowns, and it's happened just in such a short amount of time, that the unemployment rate right now is somewhere in the range of 20 to 25%. That means a fourth to a fifth of the entire population in the U.S. who wants a job currently doesn't have one. They can't find one. And so I think that the hope is that, of course, that because it was so sudden, that on the other side of this, as soon as we start reopening things, as long as the virus stays in, we sort of control these things a little bit better, that the economic impact hopefully recovers a little bit faster as well. But it is certainly the unemployed. There's more people at any given time that are unemployed right now than we ever saw in the sort of the 2008 recession. So it's, even though the absolute number of new employment claims is still just a little bit lower, just because of the suddenness of this thing, it feels a lot harder, I think, for a lot of people. Yeah,
that's definitely understandable, and very uncertain time for all those people as well. And the timeline is, we've got a question mark at the end of it. So yeah, very understandable. Thank you for that.
Yeah.
So we will go ahead and go on to our questions from our audience. Our first question, which either one of you is more than happy to take on, or both of you can answer it if you'd like, is from Facebook user Stephanie Jane Smith, and she's asking, the governor recommends gatherings of no more than 10 people. As retail stores open, is it safe to start having small gatherings with a limited number of people?
Was that directed for me? I'm sorry.
Either one of you are more than welcome to answer it.
You know, I would say that the guidance that's coming from Dr. Amy Atkin and the governor of Ohio is really clear and really useful guidance about making sure that you continue with social distancing and making sure that masks help to protect one another. They don't stop the virus from getting to you, but if everybody's wearing masks, that and social distancing can really make a huge difference in everybody keeping everybody else safe.
Great. Did you want to chime in on any of that, or?
Oh yeah, I think yeah, sure. Yeah, I think I would trust the medical experts over an economist on these things.
I was going to say,
yeah. This
may be another one of the medical expert questions. So this is from Elena on YouTube. Can you talk about how a mask might stop people from spreading COVID-19 and prevent you from getting it?
Yeah, so definitely, there are different levels of masks, right? So the one that we've heard a lot about in the news media, the N95 masks, these are, part of the protective equipment to keep the first responders and the people in the hospitals safe and protect them as much as possible from getting the virus. The sort of cloth masks and things like this, those are really more, as I said before, and again, I really encourage everybody to look at the guidances from the public health officials, from Dr. Amy Atkin in Ohio, that these masks, the cloth masks, are to stop, when you sneeze and cough, and even just talking, you know that stuff just comes out of your mouth, right? And so the masks help keep your germs from getting out as much as they would without a mask. And so each of us wearing a mask helps protect those around us, but it's not sufficient. You really also need to do the social distancing in addition to that.
Great, thank you. All right, and then we will go to another question for you, Dr. Ditcher. So now that roughly 50% of those who are employed are working from home, will we see a shift in company policy towards allowing remote work? I know people have been talking about how, air pollution is down because people aren't driving to work anymore. Is this going to be a trend for the future?
Yeah, I mean, I think this is really interesting. So we have this name on this, which is telecommuting, because this was started in kind of the 70s or late 70s, early 80s, because we commuted to work via telephone before we had the internet and all of these kinds of things. And so there has been this great hope that once technology advanced enough that everybody's going to work from home, we can have these relaxed schedules. And we just haven't realized this potential of the proposed potential of working from home. Now, all of a sudden, 50% of us that are still employed are working from home. And so the question is, are we going to sort of continue this thing? And I think the answer is probably yes. I mean, there was a recent survey by CFOs that said about 70% of them were going to, after this thing was over, they're going to institute more working from home policies. And this is largely because, well, they save a lot of money on office space, right? If you don't have to have an office for individuals, then you can save money on sort of the office space. I think that the biggest fear, whenever we think about working from home or teleworking, is whether or not the productivity is going to be the same. For the home-based workers and for those who are working in the traditional office. And we have a lot of different results. Some say, for some kinds of tasks, it looks like actually working from home, you're a little bit more productive. And that's kind of good news. But for other kinds of things, it looks like we're probably going to be more productive inside of the traditional office. I mean, think about the kinds of work that a lot of home-based workers now are doing, which is this kind of teamwork with creativity, working with, and that's really hard to duplicate in this kind of remote work environment. And so what I suspect is going to happen in the future is we're probably going to have a lot more workers that work from home, but not full-time basis. It's probably going to be the case that you're going to see a lot more of this sort of mix, working remotely sometimes and then coming in sometimes. But for sure, I think that one of the barriers before was that the companies, the HR managers didn't have these policies in place for working from home. And they really didn't possibly need to. They didn't think that they needed to. Now they're forced to do it. And all of a sudden, because they're forced to enact these kinds of policies, to figure out how to deal with these kinds of situations, because now they have the policies in place, it's much easier to roll these out to their employees and say, hey, look, we have a policy. Look, it's actually a perk. So 80% of the workers in some surveys say that's what they want. They want some flexibility, and they want to have the option to work from home. And so now companies, now that they have these policies in place, they can start offering these things as perks. So I do suspect that in the future, we're probably going to see, so we have the impetus, so behind the CFOs, they want to do it because it saves money. There's environmental concerns. You're absolutely right. I mean, if we look around at these kinds of pollution numbers, they're really going down. And a lot of that is due to, the lack of commuting from people going into work. So there's a lot of different angles that are pulling us in the direction of wanting to go towards something like this. And so it looks like that's likely going to be the case.
Great. Thank you. I know I've been working from home for so many weeks now, and I love my coworkers, but my cat's also a good coworker. So,
Yeah.
But hi, Vinny. It's nice to have you back. Thank you for joining us. I think you're still muted, but you there, Vinny?
Oops. Yes, I'm there. So
Great. It is very great to have you back. We're glad that technical difficulties have been working out. So since, unfortunately we haven't been able to hear from you in the last few questions, I'll go ahead and ask you another one if all is doing well on your end then. So Vinny, for you, can you, we've been talking about this retail. We've had questions about, retailers opening again and whatnot. So can you describe how strategies for reopening the country would work from a mathematical perspective?
Right. So, the thing is that there's this terrible virus going around, and we want to do something to limit the spread. Okay, so what we did in phase one, as it's now called in the US, we locked the country down, and that diminished the spread. Now, the important thing is that what you see in the beginning of an epidemic is exponential growth. Okay? And that exponential growth has to do with the basic reproduction number R0, later on R. And if that exponential growth goes on, then the virus will spread very fast and overwhelm the healthcare system until it runs its course, okay, until enough people get infected to achieve herd immunity. And that would be one strategy. Actually, some countries have advocated that. But in the case of coronavirus, that would mean that maybe 80% of the population become infected. In the US, that would mean that several million people would die. Okay, several million people would die if we just let it run its course. And if we compare this with September 11, there were a few thousand people who died, and that was terrible already. Okay, so it's orders of magnitude bigger, the problem we have right now. Now, with the things we have achieved in phase one, it seems we have brought this reproductive number under control to where it's close to 1. That means one person infects, on average, one other person. Okay, and that exponential growth is no longer there, but we cannot afford to let it return. So what we want to do is we want to utilize the gains we have made and limit the spread while allowing more economic activity, more movements of people, more socializing, and so on. And that requires us to carefully monitor what's going on. So what relaxation does increase this R again to high levels, and what relaxation is relatively harmless. We need to monitor this, and we need to monitor people's contacts, and that's very important. So what the plan is to bring it down to levels where we can manage to interview everybody who is a confirmed infected case, and then trace the contacts of that person, and then notify the contacts, and eventually these contacts will have to be tested. Okay. So therefore, now what we will need to do is will need to do a number of tests that are proportional to the number of daily infections. Okay. And that is the scary number. Okay. So I talked about this. The US has tested the most people, not by far the most people per million of population, because the US is just very big. And that's good. But the US has a daily increase right now on the order of magnitude of 30,000. So if you want to implement this strategy that ultimately will limit the spread to sort of bearable levels while relaxing the restrictions, and that's what we want. We want to keep the infections down and relax. Then what you have to do, you have to monitor these contacts. So everybody whom we diagnose has to be interviewed. So you need to have trained people who do these interviewing processes and trace the contacts and contact these contacts and so on. And basically at some point, maybe not the same day, but soon after, we have to test every contact. Okay, so if you're talking about 30,000 new cases and maybe 10 contacts per person, then you're talking about 600,000 tests every day. Okay, 600,000 tests, and then you will also need more tests. Some people have to retest. You need to test vulnerable people and so on. So we're talking about 1 million tests per day. Okay, and we don't have that. We don't have enough trained people. So that is where we need to really think, which number do we need to implement these measures that will keep the infection manageable while we relax restrictions. And also we need to monitor closely how the relaxation of these restrictions impacts that basic reproduction numbers. Okay, so we can afford to do that in a meaningful way. That, you know, if we just open up now, it doesn't do it any good. I mean, we might have as well not close at all. Okay, we cannot just open up without monitoring, without testing, without carefully restricting, lifting these restrictions one by one. That's what the mathematical theory tells you.
And just to add on to that, I mean, one of the reasons why it's so important to do that contact tracing is because people can have the virus and spread the virus and actually not have any of the symptoms that they would even know that they're infectious. So it's just really important that you can test anybody who might have potentially been exposed, because they could potentially themselves be spreading it.
Yeah, and maybe I'll add too, from the economic aspect. I mean, part of the goal of open, or at least the purported goal of opening all of these restrictions, is to increase the economic activity. But if all of the consumers are afraid because we think, right, am I going to go shopping? Well, maybe I won't if I really think I might catch a virus, right? And so if we have this belief that it's very dangerous to do a thing, we're going to be less likely to do the thing. And so if the goal is to increase economic activity, we have to make sure that the public feels that they are safe, or else it's not actually going to achieve that goal.
Yeah, I thank you all for chiming in on that one. And for Vinny, those numbers are, they put a really big perspective in people's minds to see really how it spreads, and thank you both for contributing to that, because I think this is a big question that people have been asking, is the spread and how easy is it to get the contact. We do have more questions from our social media channels as well. This is kind of back to the medical expert here, but Facebook user Jenny Gibson asks, if you have already had COVID-19 and have recovered, is it still necessary to wear a mask?
Again, I will preface my answer with, I am not a doctor, right? I'm not a medical doctor, nor am I a public health official. But what I have heard in the, public health officials and in the research literature, read in research literature, is that the verdict is still out right now as far as whether or not you can get it again. It's not clear, and there is a significant potential that you could potentially get it again. And so just because you've had it once, you can't ensure that you are not potentially infected with it again and potentially infecting others. So one has to continue to maintain social distancing and as much as possible, a mask to protect others from any, sneeze that you might do inadvertently, that type of thing.
Great, thank you. And then we have another question from YouTube user Alyssa Bergmeyer. How would a possible drug attack and or mitigate the coronavirus, and what would that exactly look like?
So there's actually a lot of different targets that people are looking at. So as I said, the virus has to bind to a specific thing on the outside of the human cell. So people are investigating whether or not some small molecules could inhibit that initial binding. Mm-hmm. They're also looking at inhibiting some of the other viral machinery. So the remdesivir, I said, inhibits the machinery that replicates the viral genome, but there's also machinery that process the viral proteins. And so people are looking at trying to inhibit that machinery, those enzymes. Also, some of the complications from having the COVID-19 disease caused by the coronavirus is that sometimes the immune system gets out of control. And so they're also looking at trying to find drugs that can stop that immune system from getting out of control. But to come up with a completely new compound and have it be able to be given as a drug takes many, many, many years to make sure that it's safe and effective. Mm-hmm. And so what they're doing with trying to look at all of these viral targets, trying to look at all of these disease targets, they're actually searching through known and approved by the FDA drugs that are used for another purpose and trying to see if they're active against inhibiting some of these key parts of the viral replication. And again, in the research literature, there's some really hopeful possibilities out there that are being investigated right now.
Great, thank you, yeah. And then going back to you, Vinny, question when it comes to, the differences between the response in different countries, how would you describe the important differences in the response to the coronavirus in different countries? Oh, I think you may be muted.
Well, yeah, so I'm myself. So the response to the coronavirus in different countries is, some countries started, very aggressively with, social distancing measures. That is similar to what we see between the states. The state of Ohio has been very responsible, and I think we need to thank our governor for that. Has implemented these measures early, and they were strict measures, and we don't have that many cases in Ohio. What I'm seeing is in many countries, if I compare, for example, the media coverage, let me talk about the media coverage in the US and in Germany. What I see is that in the media coverage in Germany, there is a big emphasis on what it is we need to do, what it is we want to accomplish, what we possibly can accomplish with certain types of measures. Is it worth it? How much economic pain is worth, a certain amount of decrease in the number of cases? In the US, is all very politicized. Okay, and I think what we need to do is, if we want to be successful, we need to really put emphasis on educating people what it is we need, we want to accomplish with all these measures, what it is we need to do to get out of this without restarting the epidemic. Okay, what is needed? What's the plan? What's the strategy behind it? Okay, you need to give reliable information to people, consistent information to people, and not contradictory information that one day is this, the next day is that. And that I'm not seeing. So we need to educate. It's quite sophisticated mathematical concepts that go into here, but they can be explained. And if people see the explanation and understand what it is the government is trying to do, they will buy into that. If it's all politicized, people will not buy into that. That's really what I see as one major difference. For example, in Germany, we have 5 major political parties, but I don't even know, even after reading the press, which party is in favor of this or that. The emphasis is really in the discussions, at least what I read, is much on what are we doing, what can we do, what should we do to achieve certain goals. And then that's a big difference. And also people, when people talk about it, they say, well, is that what we want? What kind of goals do we have as a society? What do we want to achieve? And people realize that there is no free lunch, if I may step on the toes of my colleague from the economics department. It's always a trade-off, okay? We can say that if we want to open up the economy sooner, there's a trade-off. There's a trade-off in more people getting infected and dying, and we can estimate that. We cannot say for sure. Or we can make the opposite trade-off and saying if we want to keep people alive, healthy, then we have to take a certain amount of economic pain. Now, reasonable people may have different political opinions about what is more important, what is better, okay? People may come down on one or the other side of the trade-off and say, well, okay, let's take this loss instead of that. And that's normal. That's healthy political discussion, saying, if we do this, we lose so many people, but the economic pain will be so much less. If we do that, we lose so many fewer people, we save people, keep them healthy, but we will have to take so much economic pain. And if people are giving this information, then they can have a meaningful discussion of what we want to do as a society, which route we want to go. This is the first thing, that's science. Science can give this information. And I have great colleagues here. We have the biologists or biochemists, we have the economists, and we have mathematics that has something to contribute, and we can study, we can understand the trade-offs involved. That's what science can contribute, okay? And then that science can put the trade-offs to politicians, to the society as a whole, and then people other than us, scientists. That's not our business. We are not the ones who are supposed to say what's better. More economic pain, more pain in terms of health. Yeah, but we need to make clear what the trade-offs are, and we need our politicians to honestly transmit this information to the general public, okay, in an honest way, and then the political discussion can start. when the information is out, when we, to the best of our ability, okay, know what we can do to achieve something or something else. And then people have choices. And it's for the people to make these choices, not for the scientists. For the scientists, to tell
I'm sorry.
choices.
Yeah, sorry. I just wanted to add on to that, a lot of this discussion also is about buying time, right? Buying time for there to be those discoveries of the molecules that are going to help treat the infection. Buying time to be able to develop a vaccine that might have some amount of an effect on things, and most immediately, just buying time to flatten the curve so that you didn't overwhelm the hospital systems, right? So a lot of these sort of choices and trade-offs and decisions that have to be made are not necessarily, the impact is going to be longer term, right? But the immediate choices don't necessarily need to be there forever. It's a lot of it is just to buy time.
Great. Thank you both for that. That is important and definitely I think has been on a lot of people's minds. So before we wrap this up, we do have 2 more questions. The first one is for you, Dr. Dutcher. It involves the economy. So how does COVID-19 affect the economy based on where you live, urban versus rural? Here in Athens, we have many small businesses, whereas in a larger, urban area such as Columbus, there's larger corporations and businesses there. So does this affect the region's economy? And if so, how does it?
Yeah, thanks for that question. So I think what we don't know yet is how this whole thing is going to affect the eventual habits of people. And so, for instance, maybe all of a sudden we've been forced to live at home for so long, and
right.
We've developed great sourdough bread recipes. And because now we have these really good sourdough bread and pizza dough and everything, because you have to use your spent sourdough. So you have all of these nice things now that you can cook, and maybe you realize, actually, I kind of enjoy cooking, and it's maybe not such of a burden. Now, of course, so you won't go out to restaurants as much or these kinds of things. And so I think what we don't know yet is how this current situation is going to affect sort of the habits of consumers. And that, of course, is going to affect whatever economy that the individual is in. And so you might see places like Athens where we are really reliant upon these kinds of things, these kinds of small businesses. And if those habits actually change, and they change in a pretty dramatic fashion, then we're going to see a bigger impact on that. We're also in Athens and around Athens, we're really dependent upon tourism dollars. And so if all of a sudden people are saying, you know what, I like staying at home, I now have bought all of these kinds of games and all of these kinds of fun things to do at home, and maybe I don't need to go out as much anymore, and I can save some money, then I think that you're going to see a bigger impact on sort of the smaller communities like Athens that rely on that versus the bigger ones. Right? I mean, we can't really say whether it's urban, rural. I think it's really what is driving that local economy. I mean, you have a lot of small towns that are reliant on manufacturing, and in that case, they're probably not going to be as affected. And so it really depends on sort of what is that core economic activity that's in that area, and then how eventually are the consumer sentiments and the consumer behaviors going to change as a result of this thing, which I think we don't actually know yet because we just never have been through anything like this.
All right, thank you. Yeah, no, that definitely makes sense that whatever your big economic revenue is for that area would be dependent on how the economy is affected for that specific area. Thank you. And then our last question is for you, Dr. Hines, and kind of wrapping this all up and looking forward as to what's to come. What are other possible treatments that are being investigated currently, to help combat this pandemic and this coronavirus?
It's been actually really awe-inspiring to see the whole world scientific community and medical community just looking at all possibilities and tracking, little anecdotal pieces of information and trying to see, is this reproducible? Does this happen the same way in another patient? There's a lot out there, and I really think there will be some good breakthroughs, but it's always going to be important to weigh safety and efficacy, right? So it has to be, whatever the treatment is, it has to not kill the patient, right? And so I think, from what I've seen in the research literature, there's a range of things, ranging from small molecules that actually just inhibit the virus to things that help support the body sort of responding and to the physiological changes that the virus is doing to it to be able to better recover and cope with it, to, again, kind of containing the immune system, to making sure that it doesn't get out of control. And then ultimately, but it does take time to develop it, ultimately a vaccine, right? But that is going to be challenging. Not only does it take a long time to develop vaccines just normally because of how they are developed, the virus mutates really easily. And so it's going to be a challenge to get a vaccine that will be really effective. So it's probably going to be a combination of all of these things to support the human's body to defend itself and recover, as well as trying to kill the viral replication and even just stop the virus from even to being able to get in and infect the cells.
Great. Well, thank you all so much for sharing your expertise with us and for answering our questions. Like I said before, this is a really uncertain time, and so I think it really gives, the audience and the public a little bit of positivity to hear from you guys, what you have to say and some outlooks to this. So again, thank you. And thank you for all of our viewers for joining us. And like I've said, if we didn't get to your questions, we will follow up with our experts here and answer those directly in the comment section for you. Again, I cannot thank you, the three of you, enough for this. We really appreciate your time and your expertise on this. So to find out all the ways that Ohio is supporting our students, our faculty, staff, and community amidst this global pandemic, check out ohio.edu.coronavirus/stories and keep an eye out for upcoming opportunities to hear from Ohio experts related to the COVID-19 health crisis. Thank you so much for tuning in. Thank you three again. Have a great rest of your day and take care and stay healthy. Thank you all.